I threw this together for us to kind of talk about what happens when somebody activates the 911 system because they've suffered a fall event. I am making the assumption that they've had some way to activate that 911 system, whether it is their life alert, they had their cell phone on them, family member found them. So I kind of made that assumption, but I can't stress the importance enough with these home visits. And I often, when I do talks like this, I talk about my Mimi. My Mimi falls, and she refuses to get that life alert, refuses. But she has a cell phone, and she keeps it in her pocket. And I call her every day to make sure she does that. So there are ways around, and I've heard a lot of good suggestions about ways to not make the elderly feel like they're being, infringed upon with their rights and infringed upon with the way they want to live. So there are ways around that. But the life alert buttons are amazing, and we go to those activations all the time. I looked at some numbers before I came today. So Mystic River Ambulance, for those of you not from the area, we serve the Mystic area. We do Groton Long Point, Noank, Masons Island. So the Stone Ridge community is ours, the Academy Point. How many falls do you think we go to every year? A lot. Just this year so far, we've been to over 100 fall victims that have been hurt and required transport. Today alone, too. So we all know this. We know that it's big. The bathroom falls that we discussed earlier are probably number one with those slipping and falling. And we're going to talk about it a little bit more. So how to be prepared if you need us. We're going to talk about identifying when to call 911, when sleeping on the floor and waiting for your son is not an option. Yes, it happens. What to expect from the dispatcher, because that can be a little scary. How to allow access to your home, because if we can't get in, we're breaking something, and we don't want to do that. Proper information to respond. We'll talk a little bit about the equipment we may use, and the patient's right to refuse transport, because that comes up a lot. I don't want to call, they're going to take me to the hospital, I'm going to end up in a nursing home, and that's going to be the end of it. And there are other options. So we want to make sure people are calling when they need to. So when do they need to call? Call if you're hurt. You fell down and it hurt. No question. Call. Press that button. You can't get up and there's no one to help you. You fall during a fainting episode or you lose consciousness. And there's going to be a discussion afterwards. I looked at the presentation briefly about medications that can cause dizziness. They can cause you get up too quick, you get dizzy, you fall over, things like that. Those sorts of events really need to be investigated at the minimum by your primary care doctor. But really, you should go to the ER and have that checked out because it could be something more significant. Our elderly population don't feel pain the way the younger population does. Now compound that with them being diabetic. Ever heard of a silent heart attack? That can present with a fainting episode. So that's really important. If the patient or the person you're talking to says, yeah, I fell like 3 times last week. Well, why did you fall? I don't know, I just woke up on the floor. Those are the falls that definitely have to be investigated. Help is available 24 hours a day. 24 hours a day. I heard the story earlier about the gentleman that would sleep on the floor with his wife. Very similar patient that to this day I think about her. She said, it was getting dark when I fell. I crawled to the phone, but by the time I got there, it was dark. Well, I don't want to bother anybody at night. She waited for the sun to come up. It was February. So how long was that night? But she didn't want to bother anybody. So please, when you do these home visits, reassure them 2 a.m., 3 a.m., 3 p.m. We're there to help, and we don't mind coming out to help because lying on the floor for that long can lead to a whole world of trouble. Never mind the pain that you're in and being uncomfortable. Who can hold their bladder for 12 hours? I can't. So think about those sorts of things. What to expect when you call 911. Our dispatchers are nosy. They're going to ask a lot of questions. But those questions are really important to answer. Be prepared to answer. Don't be scared by them. What is your address? That's super important. Not only your address, but like if your house sits back off the road, it's the driveway across from the mailbox. Make sure the houses are numbered well. If I can't read the number on the house, then I don't know that I'm at the right place. So that's important to check as you're going into someone's home, please. They're going to want to know what happened. I fell down. Okay, did you trip over something? Yes. Great. Did you pass out? Yes. So what's the difference? Someone who had an episode where they have passed out or fainted is going to get a higher level of response than someone who might have just tripped. So how many people have wondered why there's a fire truck and a police officer and this weird vehicle from L&M and then the ambulance? Why are all these vehicles there? Come on, who wonders about that? Of course. No problem. I'll try to explain that as quickly as possible. The systems here in this area are more of a tiered response. So based on the answers to your questions, our dispatchers decide how many responders are needed, what level of care is needed. So someone who tripped and fell needs a basic response ambulance. So that's when me and one other person are going to show up. We're going to assess you. We're going to take care of you. If you had a dizzy spell or a fainting episode, that's when we worry you might have trouble with your heart, trouble with your brain, maybe a stroke. And that level of response is going to get escalated. And that's when you're going to see more responders that can bring more care, more specialized care. They're going to be able to bring EKGs, IV medications, and just more hands to help us get out of a house quicker to get you to the hospital. When it's just me and my partner, and you fell down, 15, 20 minutes to get out of your house. When I have more hands, I can cut that in half. So depending on the severity of the fall, the severity of the event, our dispatchers ask these questions to make sure the appropriate response is coming. Does that help? There you go. All right. They're going to ask about other medical trouble, medical problems. If you have a history of heart disease, heart attacks, that kind of escalates things usually a little bit right away, just having that history. Is the door unlocked? Or is there a key hidden for access or something else? I'm going to talk about that a little more. Firemen love to break stuff. They love it. I used to be a fireman. I have a lot of respect for firemen, but boy, they love to break stuff. We don't want that to happen, so I want to talk about that a little bit. And I put this nice little picture of the dog. We talked about pets earlier, but approaching a house with a dog barking like crazy at us can be a little intimidating. So the dispatchers will ask about that. Do you have a dog? And if your family member is calling, they may ask the family member to secure that animal. I have dog biscuits on the ambulance. Sometimes that helps, but that can be a little intimidating. So please reassure people when you're talking to them. Make sure you call, be prepared for all those questions, answer them honestly, and we'll be all right. Gaining access. How many people have a hide key outside their house? Be honest. Okay. The dispatcher is going to ask about how to get in. Tell them where that key is. They will not announce it over the air. They are not going to get on the radio and say, Mrs. Jones' key is under the placemat on the front door. They're going to ask us to call to tell us that directly over the phone. So that's one option. Knox boxes are available through security companies, locksmiths, and what those do is they put your house key inside and the fire department through a radio frequency from the dispatch center, so it's all tracked and secure, can access that box to get the keys to your home out. Something a little simpler like realtors use, a push button. So you put the combination in again, they're not gonna say it over the air, but they'll put the combination code in and we can get your house key out to get in your house. Really important. We don't wanna break glass. We don't wanna break locks on doors because then you have the worry of how you're gonna secure the house later. We know falls are gonna happen, and the odds are when you're doing these assessments, maybe one already did. So they might share with you, oh, they broke my window. So talk to them about options to make sure we don't have to do that again. I mean, I have a key hidden outside of my house just in case, which, hopefully we don't ever have to use it. It's just my sister coming in to get my food. Providing proper information. Anybody ever been in a car accident? Anybody? It's really, in those first few minutes, you're just frazzled, right? Barely remember your name. Can you imagine in those first few minutes if I asked you to tell me, what medications do you take and how much and when? Forget it, right? Forget it. And I know that from experience myself when I was in a motor vehicle accident. Those first few minutes, I couldn't believe how disoriented I was. Falls are very disorienting, they're very upsetting. And now you're on the floor and 2, 4, 6 people are all standing around you. What medicine do you take? It's tough. So I can't stress enough the importance of some kind of medical alert information card. There's many of them out there, but honestly, if it was just a piece of paper on the fridge, you're doing better than 90% of the population, truthfully. Purses, glove boxes, multiple copies, and update them. Encourage people to take them with them to their doctor, and their doctor will help with that. That way, heaven forbid, they can't tell us anything because they're too frazzled, they're too upset, or they physically can't speak. We'll be able to have that accurate information to take with us for our purposes for assessing them, but more importantly, for the ER and the doctors. So I know that there's a vial of life that's going to go out. The state website has a form on it. I print those out and give them out like candy. And I'm still always surprised when somebody has one ready for us. So if you could please remind residents when you're out there to do this, this is huge, because they're not going to be able to tell us. And we don't like to take their bucket of medication with us, because then there's always the worry that it's not going to go back home with them. So having these cards filled out, hugely important. All right, so someone fell, they called us. We got in, they gave us their medication card, we're doing good. Well, we still got to take care of them. So we're going to touch you. We are going to touch you if you fall. We are going to touch other people if they fall. We can't do our jobs if we don't. So if you fell in the bathroom and you're not wearing anything, we don't care. We just want to take care of you. So we are going to have our hands on you. We're going to assess your back. We're going to assess your extremities. It's not just as simple as, hurry up and get me off the floor. We want to make sure that people aren't hurt. This collar that's on this woman is probably the piece of equipment that gets used the most often. And that's for preventing the neck from moving, much like you would splint. You see people in casts for their arms or their legs. It's a temporary way to just keep them from moving their neck. So that heaven forbid there's any kind of fracture in those bones in the top part of their neck, it's going to keep their neck still. And that's the piece of equipment you're going to see the most, or people talk about the most and complain about the most. It sucks. It's not comfortable to wear. It's really rigid and scary, but really, really important that we put those on people just in case. Because like I said, the elderly especially, they don't feel pain the way we do. So if we're doing our assessment, we're not getting good, confident answers, we're going to put one of these on just to be careful. The long board is a hard, rigid board that we'll use to move somebody, and they'll probably be strapped down to it. Really excited they don't have to stay on it, though. We're going to be able to get them off it onto a soft pad for the transport to the hospital, but we're still going to use it. So, scary event. Now there's all these people in my house. They're asking me about medicine. Now they're touching me everywhere. I'm really glad we're working on ways to stop this from happening for people. So refusal of transport. I mentioned earlier, just because you fall doesn't mean you have to go to the hospital. Doesn't mean I'm not going to encourage it. Doesn't mean I'm not going to give you alternative ideas or suggestions. But it doesn't mean you have to go. Simple ground level trip and falls that don't result in an injury, that weren't associated with a blackout episode or a fainting episode, it's okay not to go. It's okay to go, but it's okay not to go. We're going to still do the same assessment. We're going to still help get people up off the floor. We're going to make sure they can be safe. I always make someone that's fallen and wants to stay home take a walk with me to make sure they're safe and that they're not going to be a risk for a fall again that day, especially. I encourage them to call their doctors, and so will anybody else. And it's okay. I always encourage follow-up with primary care. Take a look at those medicines for a medication review. But just because someone falls, we're not throwing them in the ambulance and dragging them to the ER, and now they're in a nursing home. They're going to sign the refusal releasing from liability, and we're still going to need the same personal information. So we're still going to ask those medication questions, patient history, birthday, et cetera, to make sure that we can fill out our patient care reports accurately. So that's about all I did. I just did a short presentation. Hope it wasn't too short. But this whole group and this work that we're doing is a big change for EMS as a whole. We're a very reactive group, and I like the idea of being more proactive. We always in homes talk about the trip hazards and the fire, the smoke detectors, but in that 15, 20 minutes I'm with a patient in the middle of their emergency, it is really not the time when they're paying attention and listening. So I'm excited to be able to refer people to this program and hopefully not go out as often as we have been. Do you have any questions for me? Yes.
Does the dispatch center on this side of the river have the capability of geolocation?
On the Groton side of the river?
When a call comes in,
yep.
So that if the person either doesn't remember or doesn't know the address, they can still figure out where the house is.
If they call from a landline, the address will come up already. If they call from a cell phone, the towers will be able to pinpoint a location within a reasonable, area, and then they'll send, officers and stuff, and we'll try to find the right house. But
I know in Waterford, basically if somebody calls in, they have a big screen that comes up and the map zeroes in on where that place is.
Yep. If it's from a landline, we know exactly where they're calling from.
Can we talk about, common cold?
Sure.
Who can make that call? I haven't done it because I am a nurse practitioner, and I like they did come cold and, but can a civilian do it?
Sure. What she's referring to is whether or not we use our lights and sirens on the way to someone's house. The questions that the dispatcher asks and the answers that are given generally answer that question too. So if the person passed out and they're still confused a little bit, they're still on the floor, we're gonna run our lights and sirens to get there. A lay person cannot change that. When we get calls from nursing homes or there's a nurse on scene, you know, they'll ask us to come in a certain way, and we try to be respectful of that when it's safe to do so. You know, if you call and say, Mrs. Jones is having chest pain and she just passed out in front of me, but can you not run the siren? I'm gonna run my siren. But we do try to be as respectful, especially at 3 in the morning. No one needs to hear those blaring into the neighborhood, so we try. Does that help?
Yeah.
Good. Yes.
How many times will you respond when somebody says, I don't want to go to the hospital, you make that decision and say, okay, we came out 3 times in the last 2 days, you're going, or can they fall a certain amount of time?
There's, truthfully, you can fall an infinite amount of times. We can't force anybody to go somewhere against their will. If somebody has fallen multiple times, we certainly try better. We try to get a hold of family. But the bottom line is as long as someone's conscious, alert, and oriented, and they understand the risk of what they're doing, they're allowed to make bad decisions for themselves. So when we see multiple falls, that's when we really try to make sure we get a family member. Have you been to see your doctor yet? Do you want me to help you call your doctor? So being able to refer to other programs through this coalition is going to be great. You got it. Any other questions? Was that too brief? I tried to be quick. Awesome. Thank you.